Hello, my name is Nick Klensky, reporting for the RSNA Daily Bulletin. I'm here at RSNA 2019 with Dr. Benjamin Ye to discuss new applications of DualEnergy CT. Dr. Ye, what are the benefits of new DualEnergy CT techniques?
Well, first of all, DualEnergy is not new. It's actually been around as long as CT has. But what's new is that we're able to use it in a very rapid fashion clinically with really nice image quality now. And the benefits are mostly that it improves our confidence and our specificity for diagnoses. So we could take a lesion, for example, that was ambiguous before for being enhancing or just being intrinsically dense. And we can say specifically whether that really is an enhancing living tumor, which needs to be treated or resected or monitored in some way, versus something that's just benign, for example, a benign cyst. Other things we can do is we can tell whether we can see lesions with higher conspicuity than we could ever before, for example, in the liver or the pancreas or even the kidney. We can reduce artifacts without having to rescan using just controls that we would use for any other DualEnergy scanner or scan image. And we can even see invisible lesions that we could never see before, for example, gallstones or certain liver or certain bone tumors that we would just have no way of seeing. So there's a multitude of benefits, but in particular for daily use, not for every case, maybe 10% of the cases, we have some benefit in terms of confidence. And then maybe a few percent, we actually make diagnoses that we would never otherwise make.
And what are the challenges of using DualEnergy CT techniques?
Well, it's a reality that it's not widely used. It's used by people who are more comfortable with it. And so just getting comfortable with the new images. It's a new way of looking at the scans. And part of it, the issues are the workflow. There are a few more images to look at per slice. And so one needs to work in a way to make it efficient both for time for the radiologist and also just in general for example, presenting cases to the surgeon. The other issues are every vendor has a different environment, so to speak, a different look to their images. So the images from vendor A will look a little bit different than those of vendor B, and the controls for making reconstructions are a little different as well. None of the vendors can process the other vendors' images, for example. But you can certainly use stock images that are fairly similar for the vast majority of DualEnergy applications. And other things are we're just beginning to understand how DualEnergy can be used for various disease processes and for various diagnoses. So we're still learning.
How is DualEnergy CT changing?
Well, it's changing so fast. You know, having been dormant for about 35 years, it's just really taken off in the last 5. In particular, the image quality is so much better than it was with the first generation DualEnergy scanners. The scanners are much faster. Use of artificial intelligence and use of new iterative reconstruction methods really cut down on a lot of the noise and the ambiguities that were present on some of the earlier scanners. The applications that we use to view the images are faster, they're more easy to use, albeit they're still a little bit different between vendors. So there's a lot to look forward to. And hopefully in the future we'll also have new contrast agents or other things that we can use to help even further improve the image quality of DualEnergy scans.
And speaking of the future, what are the promising future applications for DualEnergy CT?
I think, you know, intrinsically, we always use multiple photons of different energies to image people, even with regular CT scans. We're just harnessing these photons, this same radiation dose. And so we will continue to have better scanners, we'll have better software. But in addition, we know we're going to also get new contrast agents, different colors, if you will. So we'll move from black and white CT to color CT, much like color TV. And we'll be able to see details of the richness that we could never see otherwise. We're also beginning to see photon counting machines, which are kind of the next step for DualEnergy to be multi-energy scans with better geometry. And we'll be able to distinguish just nuances of materials that we could never see before, as well as have lower radiation dose and also have higher spatial resolution than what we have now. And so the future looks really bright, and I can't wait for it to happen.
Thank you, Dr. Ye. This has been Nick Klensky reporting for the RSNA Daily Bulletin. You can find more RSNA 2019 news at meeting.rsna.org/dailybulletin. Follow us all year at rsna.org/news.